For our project, we decided to study the child mortality rate versus income. Our hypothesis is that if the income is higher, then the child mortality rate will be lower.
Child mortality rate, or under 5 mortality rate, refers to the probability of dying between birth and exactly 5 years of age, expressed per 1,000 live births.
Gapminder shows that there is a negative correlation between these two variables, meaning that our hypothesis is correct with having a higher income and a lower child mortality rate.
As of 2018, Nigeria has the highest child mortality rate of 100 children dying per 1,000 born, with the average income being $5,300, whereas Finland has the lowest child mortality rate of 1.63 children dying per 1,000 born, with the average income being $42,200.
Gapminder also allowed us to go back in time and see the child mortality rates from the 1800s to now. Despite income levels being different, the child mortality rates were relatively the same. This was most likely due to poor health care and lack of information that we have today. However, as times go on, we can start to see that income levels start to play a significant role in the child mortality rate.
Beginning in the 1930s, we can start to see where income starts affecting the child mortality rate.
Despite being the richest country in Africa with an average income of $19,200, Equatorial Guinea is an outlier on the graph with having a high child mortality rate of 83.1 children dying per 1,000 live births despite their income. This is because of inadequate sanitation and unhygienic conditions. It is also considered the most unprepared country for an epidemic.
Overall, we can conclude that income affects child mortality rate, and the higher the income, the lower the child mortality rate will most likely be.